Welcome to the Living Well with a Blood Cancer 2023 virtual conference. This one-of-a-kind conference addresses the unique needs of the blood cancer community and offers the latest information, tools, and resources to help support Canadians affected by a blood cancer. The Leukemia Lymphoma Society of Canada is proud to introduce today's presentation, Infection Prevention, Staying Healthy During Cancer Treatment. In this session, Pham will focus on ways to prevent infections and stay healthy during blood cancer treatment. Before we begin, let me introduce myself. My name is Catherine Yurhue, and I am a Community Services Lead for Manitoba and Saskatchewan with the Leukemia Lymphoma Society of Canada. I will be the moderator for this online event. We invite you to type your questions and comments in the Q&A box of your Zoom webinar panel throughout the presentation. An LLSC staff member will monitor the questions, and I will read some of your questions aloud at the end of the presentation. Due to the large number of participants and limited time, we may not be able to get to your answer to your questions today. Also note that our speaker cannot answer specific questions about a person's health history or status. If we do not get to your question during the live presentation, a community services lead will contact you in the coming days. Today's presentation will be recorded, therefore you can rewatch it again on our website. Next slide, please. Are you looking for specific programs or resources but not sure where to find them? We are here to help. You can connect with the community services lead in your area to receive personalized assistance in finding answers to your questions and getting connected to resources in your area. Reach out to us by calling toll-free 1-833-222-4884. Next slide, please. We invite you to visit our website, bloodcancers.ca. Our goal is to better serve the community and offer an improved experience. On our website, you will find tailored information, including resources and stories about managing the risks of infection. Visit www.bloodcancers.ca. Next slide, please. Did you know LLSC has an app where you can track your symptoms and side effects and much more? Download the free Health Manager app to help better manage your blood cancer diagnosis. It includes medication reminders, meal planners, medication and side effect trackers, plus shared caregiver access. This app is available for Apple or Android devices. Next slide, please. It is now time to introduce today's speaker, Pham. Summer has a bachelor's in science in microbiology from the University of Manitoba in 2010 and a bachelor of nursing in 2014 from Brandon University. To strengthen her portfolio and knowledge of infection control, she took the Infection Prevention and Control course with IPAC Canada in 2021. She is currently pursuing her Master's of Nurse Practitioner through the University of Manitoba and hopes to work in primary care with a focus on screening and detection for cancers. Thank you for being here today, Summer. Over to you.
Hi, everybody. I hope everyone had a good morning, good afternoon. Thank you for having me. So yes, thank you for the introduction, Catherine. So before I started my nursing career, I did do a lot of research for human genetics and HIV vaccine research. So I was pretty involved with the genetic portion of the immune system, as there are interesting things that we can find about a person's immune response against infection and any susceptibility for certain autoimmune disorders. And I wanted to do more for the people. So I went into nursing and wanted to provide direct care. And then my mom is also a reason. We are also honoring my mom, and she's my reason to be a nurse and continue being involved with the Leukemia and Lymphoma Society of Canada. So my mom, she was diagnosed with diffuse large B-cell lymphoma, DLBCL, in 2007. I was only just a kid, maybe 9 or 10, and she survived. And exactly 20 years later, she ended up with the same cancer again, which was very rare because they did all these genetic testing and it came back. And it came back more aggressive. So, we had a very, very good fight. But, she's my inspiration for my involvement to, being a nurse and wanting to pursue my nurse practitioner so I can help out, helping with screening and preventing cancers, because it's very dear to my heart. And I think a lot of the gap in care with getting blood cancers diagnosed right away is in primary care. And we know a lot of people across Canada have limited access to primary care. So that's where my goal lays and my biggest reason to be a nurse practitioner in primary care. All right. So a little bit about the immune system and the lymphatic system, because it is very linked to leukemia and lymphoma. So our immune system, it consists of cells, tissues, and organs that defend the body from infection. So from bacteria, from viruses, fungi, parasites. We have a few different kinds of cells for the immune system. So we have our white blood cells, which includes your B lymphocytes and T lymphocytes and neutrophils. And blood cancers, generally, they impair the immune system, and that makes blood cancer, patients susceptible to infections, and infections can progress quite rapidly. And bone marrow is important, because if there's bone marrow suppression, which happens through chemotherapy, it is where the location of where your healthy white blood cells are produced. And you have lymph nodes, which is a network of glands throughout your body. It traps bacteria during infection. That's why you get some swelling and sore lymph nodes. It's kind of where they trap and filter all the bad stuff. So B lymphocytes and T lymphocytes, they are our main white blood cell that's in our immune system. B lymphocytes, they grow in your lymph nodes and your spleen. T lymphocytes, they grow in your thymus. That's why it's a T. So if you look at the picture, there's 5 different white blood cells. So the ones that we will focus on is B lymphocytes, T lymphocytes, which is the lymphocytes, and the neutrophils. The neutrophils kill the bacteria, fungus, any foreign debris, and lymphocytes are viruses, and they're involved with making antibodies and generally are affected by a blood cancer. So all the other ones help out with, other things like cleaning up damaged cells, involved with your immune response and allergies. So cancer and chemotherapy, the effects on your immune system. So cancer cells, basically, they are rapidly dividing cells. They outgrow healthy white blood cells in blood cancers, and the abnormal cells, which is the cancer cell, they take over, and because they are abnormal and they're not able to perform their normal function, they can no longer fight infections properly, which put everyone with a blood cancer at risk for infection. Chemotherapy, which is called a cytotoxic therapy, which is basically therapies that are damaging to cells. They damage your oral and gastrointestinal mucosa. So that's why, oral, you can get thrush, you can get sores. Gastrointestinal, that's why some have diarrhea, they have stomach bugs. Because that's the mucus layer in those areas provide us with immune cells and infection fighting abilities. What chemo does, it releases massive inflammatory response. So then your body kind of attacks your own cells, attacks your own defense mechanism, which leads to overgrowth of bacteria and fungus or fungi, causing infection and fevers. And with having a damaged mucosa and our immune system not being able to function properly, it does lead the body to having poor tissue repair and healing. So patients with hematologic malignancy, which are blood cancer, the greatest risk for neutropenic fevers and severe blood infection called sepsis. So those are very important things that we look out for as we go through leukemia and lymphoma and chemo treatment. And chemotherapy kills rapidly dividing cells. As I said, those are cancer. However, it also affects healthy cells because they are also dividing, growing. And so what happens is you kill both good and bad, and you get myelosuppression, which is suppression of your bone marrow. And as I mentioned earlier, bone marrow is a location of your lymphocytes and other immune tissues and cells growth and production. Okay. So neutropenia or lymphocytopenia. So as I said, bone marrow suppression, that means fewer white blood cells, red blood cells, and platelets. So not only white blood cells are produced in the bone marrow, so are red blood cells and platelets. So this suppression causes blood disorders such as anemia, again, neutropenia, which is a low level of neutrophils, and thrombocytopenia, which is low levels of other immune systems that we need to fight infection. So what's neutropenia? So neutropenia is a function of the bone marrow suppression. So, and cytotoxic, which is the toxic effects to the cell from chemo. And it usually happens between 10 to 14 days from your first day of receiving the chemo. So during that 10 to 14 day range after getting your chemo, that's where you're most susceptible for neutropenia, which is, a severely low count or, amount of those neutrophils that you need to fight off bacteria. So with this very severe low number, you're not able to fight off any fungal infection, bacterial infection, even the ones that we normally would not get as a normal, like if we had a normal immune system. So it makes us susceptible to that, like infections that normally wouldn't affect us, like a yeast infection that quickly overgrows. So a severely low absolute neutrophil count. So neutrophil count. So you would hear this from your oncologist when they talk about, oh, you would have low ANC. So that's what they mean, is very low levels of neutrophils. And lymphocytopenia, which is low level of lymphocytes, so your B cells and your T cells, the ones that fight viruses. So neutrophils fight bacteria, lymphocytes fight viruses and severe infections. So again, low levels of either one of them or both, you can get what is called systemic inflammatory response. So that's when you get a fever of over 38 degrees, you get a rapid heart rate over 90, fast breathing rate, low white blood counts, and this leads to severe sepsis, so an infection of your blood. So this is a busy slide, but I just wanted to kind of go over what the infection risks are related to chemotherapy. So as we know, leukemia, lymphoma patients, you're either on some checkpoint inhibitors such as nivolumab, pembrolizumab. Those are checkpoint inhibitors. They affect the immune system. Cytotoxic agents, which they are. Steroids also affect the immune system. They cause a decrease in response from the immune system. So these steroids can include prednisone, methylprednisolone, dexamethasone, anti-CD20 like rituximab. That's a monoclonal antibody that affects a certain type of antibody. an antigen and anti-CD52. And then there's B cell receptors. So these are examples of like medication, chemotherapy, drugs that do affect the immune system. They are cytotoxic, meaning they're toxic to the immune system and our cells. So as you can see, they can lead to mucosal damage, so damage of your mucus layers, so your and bone marrow suppression. So they either affect one of each. Well, either one. So with the mucosal damage, you can get inflammation of your mucus system. So again, like I mentioned, orally or GI, which is your gut, your gastrointestinal tract, which is where you would get diarrhea and all these other issues with bacteria from other parts of your body and your colon. They move into your bloodstream. It makes it very easy to get sick from what you eat. Orally, you can get gingivitis, you can get bloodstream infections from, gum infections, periodontitis, opportunistic yeasts, meaning yeast that normally live in your oral cavities end up infecting you, and all those kinds of things. And then when we move over to bone marrow suppressions, like I said, it can affect your red blood cells, which can lead to anemia. So you would get paleness, some fatigue, some exhaustion, weakness, even difficulty breathing because you're not able to carry as much oxygen with decreased red blood cells and hemoglobin in your bloodstream, platelets. That's why some patients have increased bleeding and bruising. And blood spots, right? And then what we mentioned, WBC, which is the white blood cell count, it affects that. So it can affect your ANC, your absolute neutrophil counts, ALC, absolute lymphocyte counts. So what we mentioned earlier, very low levels of certain white blood counts, which can lead to a whole slew of infection, particularly viruses like community-acquired respiratory viruses, i.e. flu, COVID, other adenovirus, human rhinovirus, cold flu, and all those things. And it can also cause reactivation of old viruses like herpes, like cold sores, any hepatitis reactivation. So it really, like, chemotherapy is very important, but it can also really lead the body to such an amount of risk for certain infections. So it's why it's so important that we are talking about it and try to find ways to be healthy. Okay, so for signs of infection, you want to report any signs of infection to your doctor right away. So these would include a temperature of over 38 degrees, which Celsius, 100.4 Fahrenheit or higher. If you're getting any chills or sweating, any diarrhea, because it can mean a GI or gastrointestinal bug or source. Any burning feeling when you urinate, as that can be a sign of a urinary tract infection. And urinary tract infection have mucus layers that could be damaged from the chemo. Any ongoing cough or sore throat, any odd vaginal discharge or itching, any redness, swelling, heat, tenderness around any joint at all, any sores, any pimples, or even around any IV site or your PIC site, or portacath, as I know some cancer patients might have portacaths or PIC sites. So making sure, if you see any redness, swelling, or heat, it feels warm to touch, definitely is a sign of infection. Any pain in your tummy, bleeding gums, or white patches in your mouth, because that could be a yeast infection. And any type of infection, whether minor or not, they should be seen and notified to your doctor right away. Okay. So to stay healthy, as I said, chemo is a good thing and it's also a bad thing. It can affect your appetite. It causes nausea, vomiting, loss of taste, constipation or diarrhea, extreme fatigue. Steroids can also increase appetite and go the other way and cause weight gain, which then lead to increased blood sugar in your bloodstream. So you can have abnormally high blood sugar, which then can cause you to be thirsty, tired, and just generally unwell. So you want to make sure you move. So stay active with light physical activities and stretching. So walking and yoga are very good activities to pick up. It helps circulate the blood in the body, making sure that you are moving, doing anything that allows you to increase your heart rate, move so that you feel better, and getting your blood going is good. Eating well is very important. So plant-based proteins, they're great for you, because as cancer patients, they do have low protein or deficiency in it because they're not eating as much. So we want to make sure we load up on protein, whether it be plant-based, any lean meats like chicken and fish, but try to be careful with fish due to the exposure to any chemicals or mercury that certain fish may have. And like I said, I bold high protein diet. It's very important to get that because protein helps with muscles building and also cell and tissue and immune system. It is very helpful for patients to be on that. Healthy fats, very important. Avocado and olive, they're great fats for you. Coconut is also another good fat because you need that for regulation of hormones. And, our hormones can be out of whack when we're on chemo, especially with prednisone or other steroids, because that is fat soluble. Making sure we stay away from processed carbohydrates. So you want to stick with bran, whole wheat, oats, sweet potato over white potato. Processed carbohydrates have lots of sugars in it, and sugar is not something you want to increase in your diet when you have if you're fighting cancer and you're on chemo and steroids. You want to make sure you drink lots of water and avoid sugary drinks. Drink smoothies if you can't, if you don't feel like eating solid foods. As I know, my mom would never eat solid foods just because she's like, I'm so tired to just even chew. So making smoothies with protein powder, fruits, and veggies like kale are great examples of staying hydrated and also giving your body the nutrients it needs. Okay. And when you do get any cuts or wounds, make sure you protect it very well. Like I said, with chemo, it can affect your ability to fight off infection and your platelets. So you may not be able to, your body may not be able to close that cut right away. So it puts you at risk for entry of bugs that we don't want, so bacteria or viruses. So wash any wounds thoroughly, apply antibiotic cream like polysporin over and cover it with a Band-Aid or dressing, keeping it dry and clean. Try to be careful around sharp objects. So maybe sewing would not be a good hobby to do during this time of your life. Just, we don't want you to poke yourself or anything like that. It can really be detrimental if we do end up getting an infection, right? If you do want to clean or do some gardening, I would wear gloves. And I would also suggest wearing a mask when you're doing gardening, just because there's spores in bacteria or fungal spores in the soil. If that is what you really want to do, gardening, it can also be very calming to some patients. I wouldn't generally try to tell my patients to stay away from gardening, but you might want to have house plants or something. So that's some things you can do to protect yourself while you're doing gardening or repotting of plants. When you're out in the sun, making sure you protect your skin, especially if you're getting chemo and radiation. It makes the skin cell very, very, very fragile, and it's already burnt, it's compromised. So you want to make sure you have sunblock and protective clothing on. and really practicing good oral hygiene, brushing your teeth, rinsing your mouth, relieve any symptoms and aftertaste if you have them. I would also suggest avoiding any mouthwash that contains alcohol, because alcohol can also be quite irritating to the mucosa or the mucous membranes. And, just making sure you protect your mucosa membranes in your mouth with good oral hygiene. Okay, and it would be a good idea to include dietitians in your health journey. They can provide many different suggestions in types of diet. Some of them are able to calculate your metabolic rate. They can calculate how much calories you should have. They can provide you lots of services. So they are a great resource to go to during your health journey. Avoiding alcoholic beverages, tobacco products, and secondhand smoking is very important. Alcoholic is very irritating to the stomach, to the mucous membranes. Tobacco can, irritate it as well, and it's not going to add any benefit to your health while you are having chemo or radiation or treatments like that. And avoiding any salty, sour, spicy, sharp, crunchy, citrusy food, because if you have mouth sores, it can really, really irritate it. Having crunchy food can scratch your gums, and that can lead to bleeding. That can lead to a open wound, which can then have bacteria or yeast enter it, and then our gums are very vascular, meaning they have lots of blood supplies. That would be a quick trip to the heart. And if you have any infections in your gum or your mucosa membranes, you could get infection of the heart, like endocarditis or myocarditis. So it's very important that we keep our gums and tissues in there very healthy, intact, and hygienic. Again, avoiding any sharp objects like toothpicks. And for your mucous membranes, they're very fragile. It's very important to keep them moist. That's how you can protect the tissues. So you can use a humidifier. It really helps with keeping it clean, moist as well. And when it's dry, you also have a collection of thick mucous membranes, which makes it very hard to get rid of, and can cause respiratory infections as well. An air purifier for cleaner air is a great thing to have too, and especially when in the springtime or the fall, when you have lots of pollens and spores or molds in the air. It's a very useful device to have. I used it a lot when my mom was quite sick. Okay. So vitamins and supplementation. So it's quite a controversial subject because there's many inconclusive studies and research regarding vitamins and supplementation use while we're on treatment, because some may interact negatively with chemotherapy. So if you're interested in taking certain supplements, always discuss this with your oncologist, because it's very individualized, it's case dependent, and your treatments are important, and we don't want it to be less effective because we're taking a certain type of supplement. So what's interesting is some studies shows that antioxidant supplements like vitamin A, C, and E, which are all great vitamins when we're taking it on a regular situation, they were associated with higher rate of cancer recurrence, so the return of cancer. Other vitamins like B12 and iron were also associated with a negative effect on survival rates after cancer treatments. So that's why it's very important to talk to your oncologist, who will know more specifically about your specific treatment and your body. So it's not something that we can just go to Shoppers or something and pick up because you hear it's an antioxidant. It is known that vitamin D deficiency is very common in cancer patients. So discuss this with your oncologist. Going out in the sun, wearing sunblock, that's also a dose of vitamin D. That's a natural way of increasing your levels, but definitely talk to your oncologist about how you can increase your levels without affecting the efficacy of your treatment. There are studies that shows that oral glutamine, they will help with your mucous membranes and your gastrointestinal. So the two systems I mentioned earlier that are affected adversely by chemotherapy. So that it might help with decreasing the inflammation in your mucous membranes in your mouth and decrease the recurrence of diarrhea and irritation to the gastrointestinal tract. Melatonin may also help with some side effects of treatment. Probiotics have potential benefits to keep your gut healthy with good bacteria. But again, it's always a good idea to speak with your oncologist, as every treatment is different and each supplements may affect it a certain way. Okay, so infection prevention. So the best and most simple line of defense is practicing proper hand hygiene. It is the most effective thing to do anywhere you do hand hygiene is the most basic but an easiest way to fight off infection and prevent infection. So you would wash your hands with either soap and water for 15 to 20 seconds so you can sing yourself happy birthday, or the gold standard is 70% alcohol. However, I do know a lot of cancer patients have very, very fragile skin, and cuts are, like it stings generally to use alcohol. But gold standard, under normal circumstances, 70% alcohol is the best because it kills the microorganisms right away. And whereas soap and water, it's really dependent on the user. So the person really, really needs to scrub really hard, not hard, but scrub really well, under 15 to 20 seconds, soap and water. That washes away the germs, but it doesn't necessarily kill it. So being cognizant of that, washing in every crevices that you can and giving a good rub, it's very important. So it's very important to wash your hands before, during, and after cooking, and before you eat, after using the bathroom, after blowing your nose, coughing or sneezing, after touching your pet, if you have any, and after touching any dirty items like garbage, dirty laundry, and particularly important before and after any wound care and caring for your access device like porter cath, or a PICC, or a urinary catheter. So it's very important you do it. And immunizations, such as influenzas and pneumococcal shots, they're very important to have. I would definitely discuss with your oncologist the timing, because there's certain times after receiving chemo that you should be getting immunization, because that's the time when your immune system will respond the most, and is responsive to the shots. Pneumococcal pneumonia, which can be prevented from the pneumococcal shots. It is a very serious flu-related complication in patients with cancer. So it's a very important vaccine to get. And COVID-19 vaccinations are also very recommended. Again, just like the flu shot, speak to your oncologist as to the timing that you should get it. And sometimes certain types are like certain brands might be better than the other, but that's something that you can discuss with your oncologist, because again, depending on where you are in your treatment, there's times when it will be responsive and there's times where it won't do anything for you. So it would be a waste. So definitely talk to your oncologist and your oncology team about when to get them. Okay, and then you also want to make sure you're avoiding any sick contacts. So anyone who might have a cough, sore throat, runny nose, any minor respiratory issue, you definitely want to avoid. just because you're very susceptible. The immune system of somebody undergoing chemotherapy, we like to say that it's even weaker than a newborn, because at least, the newborn can get their immunity from their moms when they're breastfeeding. Chemotherapy itself is just very damaging to the immune system, and for the mechanism that they need to be, and the reason, that's just how they work. Practicing good personal hygiene, so showering or bathing daily if you can, keeping your nails short, just general personal safety like that is very important. Clean clothes, avoiding dusty areas or areas where mold growth can be present. So any damp, dark basements, maybe avoid being there for a while. I would not do any renovations or anything like that. That's very risky. A lot of cancer patients can end up getting aspergillosis, which is the mold infection of the lung, and it can be quite devastating. So definitely be far away from any mold growth area or dusty areas. Avoiding crowded areas, so malls or busy times when you're doing grocery shopping or events. I wouldn't go to a concert or anything like that. If you need to go to a crowded area like Costco, for example, because you need groceries, definitely wear a mask and try to limit your time in those types of areas. Wiping down and sanitizing your living areas or high touch objects often. So your phones, computer, door handles, car interior, steering wheel, the shift, the door, especially if you're driving a lot, making sure that you keep that area clean as best as you can, and avoiding any public pools, saunas, hot tubs, spas, nail salon. I know sometimes that's what we use for self-care, but these areas are very high risk because there are certain bacteria that really thrives in water environment, and hot tubs or heat, like a heated area. You want to really avoid that. Um, like I said, avoid gardening as best as you can. Any yard work, any potting soils or dirt, you can have your family member help you with potting of plants. It's just the easiest thing to do is avoiding it completely. And for sure, any animal droppings. So cat litter cleaning out of pets areas, definitely avoid that. Lean onto your friends or your family to do that for you, or you may have to have your beloved pets live with other family members for a little bit, just because you don't want that risk as much as they are our loving family member. Washing your vegetables and fruits thoroughly with soap and water before peeling or cutting, just because there's pesticides, there's bacteria on the surface of every fruit in every grocery store, so you want to never eat fruits or vegetable that has never been washed. Any bruised or damaged produce I would discard, because this is where bacteria and fungi thrive. They grow in these damaged parts of the fruit, so I wouldn't even like try to cut them or anything. I would definitely throw them out. So it's not worth the risk. Avoiding any vegetables that cannot be washed well, such as blackberries or raspberry, because of all the little pockets that you can't really properly clean. It's just better to avoid than taking the chance. Avoiding eating raw foods such as sushi or lightly cooked foods like rare steak or soft cooked eggs, because not all bacteria will be killed, and there's risk of foodborne illnesses, and it's just not worth it, and your mucous membrane's already compromised. When you buy salads or like pre-washed vegetables, I would definitely also run them under water as well and rinse them well, just because pre-washed doesn't mean that it's properly washed, and what happens between the washing and the packaging, we don't know. So it's best to have pre-washed produce rinsed. Okay. Washing the top of lids of canned foods with soap and water before opening, because there's always bacteria or dust sitting on top. So you don't want to introduce them into the food. Refrigerating any unused or uneaten foods that into the refrigerator at or below 4 degrees within 2 hours of serving, less than an hour if it has eggs or cream in it. Do not refreeze any thawed food. And when you're thawing food, frozen items, make sure you thaw them in the fridge and not in room temperature on the countertop, because that can provide an environment for bacteria and yeast to grow. Okay. And avoid contact with your loved ones if you are feeling unwell and sick, just because that's your immune system is low, and it's even lower when you are sick. So if they need to see you or they're taking care of you, they'll have to wear a mask, they'll have glove up. So making sure that they have proper protocol or clothing or protective equipment to help out is important. Make sure that healthy caregivers try to assist your family member with cancer with any housekeeping duties, cooking, cleaning duties, or pet duties. That will help out a lot, and it doesn't expose them to these issues of infections. Frequent hand washing before and after touching any living areas, food, drinks, and the patients themselves, keeping them cocooned up in a clean kind of environment is very important. And as caregivers, educate yourself on your loved one's cancer and treatment. Every treatment is going to be a little different. Knowing a lot about the type of cancers and what to expect is very important. And just being present with your loved ones with cancer, be involved in their care, and be communicative with their care team. It's very important. And staying organized with their appointments, medical records, tests, and medication is an important one too, because a lot of patients with chemotherapy, they don't have the best memory. They get a lot of brain fog, and they rely a lot on you guys to take care of that for them. And so staying organized is very important to help your loved one who's going through this journey. Okay. And closely monitoring your loved ones for any changes in symptoms or signs of infection, and informing their healthcare team right away as soon as you notice anything. That's very important. And just being supportive and hear them out. There will be days where they will feel like giving up. There will be days when they're angry at you or they're angry at everyone else. Just accept their experience in reality, because especially in patients who are told that this is terminal, this is how you're going to be living the rest of your life out as, or receiving poor prognosis or bad news, they often will take it out on loved ones just because they're fighting a very hard fight. And just being supportive, hearing them out, and just accepting them for their day is important, because then they feel supported. They won't know at the time when they're angry and being upset or moody, but that's why as caregivers we want to provide them the best of our time and unconditional love for them, trying to be positive for them, spending as much time together with them, and also taking time for yourself. So you also need time to process things. So talking to somebody else about what is happening through therapy or counseling, or even talking to another family member or friend, might be helpful for caregivers. And if you are the only caregiver, you might end up with caregiver burnout. So it's important to take some time for yourself and taking care of yourself as well. And if there's any family conflicts, as there always are in a lot of families going through cancer and everything else, don't focus so much on the family conflicts or the drama. Just try to prioritize and focus on your loved one's struggle and their journey, because that's more important than the conflict that is happening. and it's really important to take care of your own health, making sure you're sleeping well, your diet is good, exercising, and taking any stress, relief activities, and self-care. Very, very important, because you can't take care of somebody else if you can't take care of yourself. So it's a balance that you should try to utilize on yourself. All right, and that is all. Does anyone have any questions? You're muted, Catherine.
Thank you, Summer, for that wonderful presentation. That was very informative. Lots of great information. Again, your expertise and insight was just amazing, and I'm sure everybody's going to walk away from today with a lot of information. But it's now time for a question and answer period. If you haven't done so already, be sure to use the Q&A box in your Zoom webinar panel to type your questions. As we mentioned earlier, due to the large number of participants and limited time, we may not get to all the questions. If we do not get to your question during this live presentation, a community service lead will connect with you in the coming days to answer your questions. So we're just going to head over to the question, and first one coming out of the panel is any recommendations regarding infection control and recommended practices regarding being in public or at social events post-stem cell transplants at 3 months, 6 months, or post 6 months?
That's a very great question. I actually talk a lot at a different conference about patients who have post-stem cell transplant. So post-stem cell transplant patients are considered very, very high risk. Definitely would not want to, like, 3 months, 6 months post. That's a very high risk time to be socializing. That's when your body is still, your body had no immune cells at all. Then they got the stem cells put into, transfused or donated to them. Their body is still figuring out what is good and what is bad. And that's why certain people end up with rejection of it, of the bone marrow transplant and the stem cell. So it's really important that we allow time for our immune system to adapt to this. So I really wouldn't recommend going out in crowds, but if there is a need to because of family events or like you need to, definitely hand hygiene is very, very important. Hand hygiene, so carrying hand sanitizer with you all the time, making sure you wash your hands religiously, wearing a mask to protect yourself, and making sure you really pay attention to your body. So like any fevers, any temperature change, anything like that, that's very important. And just, I would avoid any like raw or cold foods, just stick with cooked foods, just staying far away from people who are sick, like with a sore throat, runny nose or anything. It's also a time too when most vaccination will not do anything because your body still has not adapted to its new immune system, so it may not respond to the vaccine as you normally should, and it would kind of not protect you at the time. So just being very, 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 very cautious of who you're with around, making sure that you protect yourself, definitely keeping everything clean with you, and just being very cognizant of how you're feeling. I hope that helps.
No, that's a great answer. Great answer. So for people on watch and wait, who have CLL or SLL, are these infection risks just as high, or are they just more heightened during chemo?
Yes, so CLL, SLL, so basically your lymphocytes, your white blood cells are already compromised. So you are at risk for infection. obviously not as high or not as suppressed as during chemo. So you should also try to follow the basic infection control. So, hand hygiene, very important. Respiratory hygiene, so masking if you're going out, just because you're still at risk for a poor response to any infection, and staying away from dusty, dirty areas. So you still want to, follow those basic practices as well. So yeah, that's it's definitely more heightened when you're getting chemo, but anyone with blood cancers in general, you guys are going to have a low immune system response to infection.
Great. Next question is, during treatment, should someone cancel dental teeth cleaning appointments?
During treatments, so so oral hygiene is very important for sure. And I also understand, we need good oral hygiene to maintain health. But if you do have dental cleaning that puts like really sharp objects in your mouth, you might, kind of delay that until you're in a better place, or you let your dentist know, or your dental hygienist know, because they could put you on prophylaxis, so antibiotics that might prevent an infection. So there's options of that. So you might want to talk to your dentist, like, so I'm on chemo, I'm concerned about getting infection, especially with cleaning, because there's scaling and tools that are sharp. Is there any way that you can help me prevent getting infection? And they'll be happy to help you by either delaying it if you don't need it right away, or giving you antibiotics. So it's definitely a good question to ask your dentist, and also asking your oncologist, because knowing certain antibiotics can also affect the efficacy of your chemo treatment.
Great, thanks, Summer. So what are some of the ways people with blood cancer get sepsis?
Basically, anytime you get an infection, you can lead to sepsis. Having a sore throat, becoming pneumonia, that can easily get you into the path down sepsis. So sepsis is a very bad and but common things that it's a common infection that a lot of cancer patients suffer. So it's just basically preventing getting the infection in the first place. And if you do get an infection like a pneumonia, definitely getting antibiotics right away, getting good diet will help fight off some infections as well. So ways could be like from a cut, like if it's also compounded and compromised or complex, like it's complicated by if you had diabetes, because already diabetes put you at risk for severe infection. So, making sure you clean that cut really well, because patients with diabetes, they have high sugar in general, and they have poor response to infections as well. So it could be from chemo, it could also be from your diabetes, or it could be from not cleaning your infections. So just making sure that you take care of your diet, and practicing good hand hygiene, practicing keeping your wounds well cleaned, and just prevention from any types of cuts, from any colds, from any of stomach flu, because all of that can cause sepsis. And just being very cognizant in trying to prevent getting that in the first place. And then if you do get a small cut or anything, treating it right away is very important.
Great. So, question about masks here. Is there a specific type of mask that should be worn in public? Is there a specific type of mask that cancer patients should be looking for? Is it something that they can just purchase anywhere? Are there some that are better than others?
Yeah, that's a really good question. So, as we know, those normal surgical masks that anyone can get anywhere, they are loose around the sides, right? So they don't actually prevent a lot of particles from coming in. So the best way, obviously the gold standard is having a very fitted mask, which is an N95 respirator, but obviously the member publics won't have access to that. So the best thing that we can suggest is having a K9, I think it's a KN95. Those are sold in public. You can find them in stores or like those personal protective equipment stores, and certain health or like drug stores. Like KN95 is as close as you can be to an N95 because it's much more fitted. It's made of a thicker material, and it's gonna be a lot more comfortable than an N95 because it's not gonna pull and leave indentations. But KN95s, they are the best you can get in terms of like consumer products, and that helps with filtering out almost 95% of particles. Obviously not as best or great as a respirator that healthcare workers we use and we get fitted for that leave indentations, but KN95s are good. And if you don't have access to that, making sure that you you can double mask, where you would have the one closest to your face. If you tie a knot to really close and minimize the gap, and then putting over top another mask, that can help. But obviously that can get quite hot. So I would say try to get in KN95 or access to them if you can. They are pretty good products.
Perfect. Great. Just a question here about after 10 to 14 days after chemo treatment, do you stay away from people during that period of time? Because it takes a while for the cold or flu to develop. Someone may not think that they are sick, but 2 days later they have a cold or a flu. So what's your recommendation on staying away from people between the 10 to 14 treatment day period?
Yes, that's a really good question. And I would definitely stay away from people during that time, just because you're correct. Somebody may say that they aren't sick and then 2 days later they have a cold and flu. Because, for example, COVID, it takes anywhere from 5 to 14 days for the body to incubate with COVID, the virus, and then they get symptoms and they get infectious. And then generally with COVID, you're infectious 2 days before you have symptoms. So it's, especially now with COVID and flu being at the highest, I would definitely try to stay away from people between that time, because it's such a risky time and easiest time, and like that's when your white counts are going to be at the lowest, and you don't want to put yourself at risk. And it's such a risk, and it's so hard to kind of really be timing it. We're like, oh, this person is not sick, so I should be fine. And 2 days later they get sick, and then you were basically exposed to them because they were infectious without them having symptoms. So I would definitely stay away from people between those critical days after chemo.
Perfect. And I think this is going to likely be probably our last question, but outside of chemo, should people with blood cancer who are immunocompromised avoid public pools, hot tubs, saunas, anything like that?
Sorry, where was the question?
Get this down here. Outside of chemo, should people with blood cancers who are immunocompromised avoid public pools, hot tubs? What is
Oh, yeah. So outside of chemo, should people with blood cancer who are immunocompromised avoid public pools, hot tubs? Generally, I would say yes, just because, again, when you have leukemia or lymphoma, that means that your white blood cell is compromised. It won't have the ability to fight off infections. So you may not be at a higher risk when somebody's undergoing chemo, but it is something that I would recommend you stay away from unless, especially public pools for sure, and public places like thermia, unfortunately, or places where you have spas and stuff. But I would recommend avoiding those. Is there a certainty that you'll get an infection? Probably not, because you're not as a heightened risk as somebody going through chemo, but it is a risk that you are taking, just because a lot of certain bacteria that loves the heat and fungi loves the heat grow, and it's definitely not something I would risk, if that makes sense.
Great. Thank you, Summer. And that is actually all the time we have for questions.
I do want to mention something about, I know somebody asked about rituximab. So I know patients who are not undergoing chemo, but they're on maintenance doses of rituximab. Rituximab is notorious to really decrease your immune system. So it really does affect your immune system. So I would definitely be just as cautious on rituximab as I would getting chemo, because it's a monoclonal antibody. It affects your ability to fight off infections, and a lot of cases that I've had to deal with in terms of COVID infected patients were on rituximab and maintenance doses. So being very careful with any targeted drug therapies like rituximab, pill form or not, it's very important that you protect yourself just as much as somebody undergoing chemo.
Perfect. Thank you very much no problem. Thank you so much for catching that. So as I mentioned, we're finished up with our questions and answers. And again, thank you so much, Summer. That was absolutely wonderful.
Thank you.
You're welcome. So before we sign off today, I would like to remind everyone of our upcoming conferences this week. So tomorrow is Blood Cancer and Spirituality. In December, new treatment guidelines for chronic lymphocytic leukemia. Next slide, please. We would also like to thank AbbVie, AstraZeneca, BeiGene, Bristol Myers Squibb, GSK, Janssen Pharmaceutical Companies of Johnson & Johnson, Jazz Pharmaceuticals, and Kite, a Gilead company, for their support in making these conferences possible. Next slide, please. Please remember that we are here to help. You can reach us by email, by visiting our website, bloodcancers.ca, or by calling us toll-free. Please note that a short survey will be sent to all participants after this presentation. Please take a moment to respond, as it helps us plan future events. Thank you for being with us today, and take good care of yourself.